Heart disease is the leading cause of death and disability in American women.
There are certain risk factors that actually are more likely to cause effects in women when compared to men. So these risk factors include diabetes, smoking, as well as anxiety or depression.
Having belly fat or central obesity, having low levels of HDL or good cholesterol is a risk factor that's greater in women versus men.
And then there are particular risk factors that are very specific to women, and these risk factors are mainly during pregnancy. If during pregnancy you were diagnosed with high blood pressure, if you were diagnosed with high blood sugar, like diabetes, for example. Also, if you were diagnosed with preeclampsia. Menopause affects heart disease risk because there are fluctuations in hormones. We know that the estrogen our body naturally creates actually protects our heart. And once we go through menopause, we no longer produce a large amount of that estrogen.
So the classic symptoms, the textbook symptoms we talk about are chest pain, chest pressure, an elephant sitting on your chest. Common presentations we see in women more than men are fatigue, shortness of breath, nausea, and of course we see numbness and tingling down the left arm, or numbness and tingling up the left side of the neck, or even the back.
So it's really important, one, for a woman to recognize that she might not have the Hollywood heart attack. In fact, it can be some of these less common symptoms. And about 30% of women that we see have heart attacks, they have heart disease in the smaller blood vessels.
We know that these patients should be treated very similarly to as if they had blockages in the major arteries of the heart. So we should make sure their cholesterol is lower. We should talk to them about maybe being put on medications to lower their heart rate or lower their blood pressure.
Women are more worried about cancer than heart disease, and even though heart disease is the #1 killer of women in the United States and kills more women than men, women know their numbers. They know the number on the scale, and they know the number of the size clothing that they wear, but they don't know their blood pressure or cholesterol numbers. And this is really important to get your screenings and know those numbers.
The best way to prevent heart disease is to learn your risk factors, such as get your cholesterol and sugar checked, quit smoking, exercise. If you're armed with knowing your risk, so that you can prevent heart disease, or should you have a symptom, getting early treatment, you can lead a healthy life even if you've had a heart attack.